Dilation of nephrostomy, ureters, or urethra, RSI. For urethral dilation, a guide wire may be advanced through the urethral stricture and one or more catheters of increasing size placed over the guide wire. A balloon is inserted and inflated until the stricture is dilated. This code reports the radiological supervision and interpretation. Cholecystography, oral contrast. Oral cholecystography provides radiographic visualization of the gallbladder after the oral ingestion of a radiopaque, iodinated dye that comes in the form of pills. Adequate visualization of the gallbladder requires concentration of this dye within the gallbladder. On X-ray film, the biliary calculi, gallstones, are visualized as radiolucent shadows within a dye-filled gallbladder. Gallbladder polyps and tumors can also occasionally be seen as filling defects. Cholangiography and/or pancreatography, intraoperative, RSI. Additional set intraoperative, RSI. In intraoperative cholangiography, the common bile duct is directly injected with radiopaque material. The surgeon removes the gallbladder. Stones appear as radiolucent shadows. Gallstones, tumors, or strictures cause partial or total obstruction of the flow of dye into the duodenum. Manual application of stress performed by physician or other qualified healthcare professional for joint radiography, including contralateral joint if indicated. Joint radiography is done under manual stress application conditions performed to visualize characteristics of the joint that would not normally be seen on films taken in routine positioning. The provider puts on lead-lined gloves and forcibly holds the body part in the desired position to maintain stress on the joint while X-rays are taken. This code includes radiography of the contralateral joint, if indicated. Temporomandibular joint arthrography RSI. A radiographic contrast study is performed on the temporomandibular joint. A contrast material is injected into the joint spaces, followed by X-ray examination of the joint. This allows the physician to see the position of the structures not normally seen on conventional X-rays. Urography, pyelography, intravenous, with or without KUB, with or without tomography. Radiographic imaging of the kidneys and ureters is done before and after the administration of an intravenous contrast material. Abdominal films are obtained and contrast medium is injected into a vein. Radiographs are again obtained while the contrast material is being excreted. This is also known as intravenous pyelography or IVP. Urography, infusion, drip technique, and/or bolus technique. With nephrotomography, radiographic imaging of the kidneys and ureters is done immediately following an infused intravenous drip or a rapid bolus injection of contrast agent. A front-to-back film of the abdomen is taken after contrast administration. Report 74415 if done with nephrotomography, X-rays taken onto film moving opposite the beams to yield a single plane shadowless image. Urography, retrograde, with or without KUB. Radiographic imaging of the kidneys and ureters is performed following retrograde, against the normal flow, administration of a radiopaque contrast material. A catheter is passed into the bladder and on through a ureter into the kidney. The contrast material is injected through the catheter or tube. Films are taken to show the flow of contrast as it moves through the urethra and into the upper urinary tract. This may be performed with KUB, a general X-ray of the abdomen. Urography, antegrade, pyelostogram, nephrostogram, loopogram, RSI. A radiographic exam of the urinary tract is performed with injection or installation of a contrast medium. This test is done to follow the normal flow of urine through the tract, antegrade, and may identify obstructions, abnormalities in the urinary tract, or assess function following surgery. Contrast medium is introduced percutaneously with a needle or through an existing tube, catheter, or stoma. For percutaneous needle injection, the skin is anesthetized and the needle inserted under fluoroscopic guidance into a calyx of the kidney. Contrast medium is injected and radiographs are taken. This code reports the radiological supervision and interpretation. Use a separately reportable code for the surgical procedure.